What personal protective equipment stops flu droplets spread? Imagine trying to keep tiny invisible droplets from sneaking into your body or reaching others when someone coughs or sneezes. That's where personal protective equipment, or PPE, comes into play. To stop influenza from spreading through respiratory droplets, the main tools are face masks, gloves, gowns, and eye protection. These items are designed to create a barrier against the droplets that travel short distances, usually about 6 feet or less, when an infected person talks, coughs, or sneezes. Starting with face masks, they are the most essential piece of droplet protection. Wearing a surgical mask or a similar mask before entering a room with someone suspected or confirmed to have influenza helps prevent inhaling large droplets. Masks also reduce the chance of spreading droplets from your mouth or nose to others. It's important to put the mask on properly and remove it carefully when leaving the area. Masks should be used once and then discarded to prevent contamination. Gloves are another key part of PPE. They protect your hands from touching respiratory secretions or contaminated surfaces. When caring for someone with influenza, gloves should be worn to prevent the virus from transferring to your skin. After use, gloves must be taken off immediately and disposed of properly, followed by thorough hand washing. This prevents the virus from spreading to other surfaces or parts of your body. Gowns are worn to protect clothing and skin from respiratory secretions that might splash or spray during close contact or certain procedures. They should fully cover your clothes and be removed carefully after use to avoid touching contaminated areas. Gowns are especially important in healthcare settings or when performing aerosol-generating procedures that could release infectious droplets into the air. Eye protection, such as goggles or face shields, guards the mucous membranes of the eyes from infectious droplets. This is particularly vital during procedures that might produce splashes or sprays of respiratory secretions. Wearing protection adds an extra layer of defense, especially when working closely with infected individuals. It's also important to remember that influenza viruses can survive on PPE surfaces for several hours. This highlights the need to replace or remove PPE carefully and promptly to prevent cross-infection. Using PPE is part of a comprehensive infection control approach that includes vaccination, practicing respiratory hygiene, and maintaining good hand hygiene. Washing your hands thoroughly before and after handling PPE helps prevent indirect transmission. In summary, using the right PPE correctly, face masks, gloves, gowns, and eye protection, significantly reduces the spread of influenza through droplets. These measures, combined with good hygiene practices, are recommended by health authorities worldwide to keep both healthcare workers and the community safer. Always consult healthcare professionals for personalized advice and follow local health guidelines to stay protected.